everybody. Welcome to Ask the Anabolic Doc, starring Dr. Thomas O'Connor. Dr. Thomas O'Connor is the author of America on Steroids, A Time to Heal. You can get that at his website, metabolicdoc.com. Do we still say anabolicdoc.com, Doc?
Yes. Oh, yeah.
Okay, or the other website, anabolicdoc.com.
Always have.
Amazing YouTube channel that he has called Anabolic Doc. Crazy content on there, tons of great stuff. But right now, we're lucky enough to have him right here on Muscular Development. So welcome, Doctor. How are you, sir?
Excellent, Ron. Good to see you. Beautiful summer.
Yeah, we missed, I haven't talked to you in 3 weeks. We missed one show because I was flying to Tampa that day. And then last week, your home flooded. Your basement home gym got flooded. Terrible news. Tell me everything's fine now.
Everything's fine. Got rid of the rug. Got Serve Pro. Little pump for Serve Pro. Guys are good, man. They come. They take it right out of the movie, you know.
Huh. Okay. So your bench press didn't like wash away in a flood or anything, right?
None of that stuff got in the bars, though. The bars were on the ground. I have some new bars, the Texas Power bars, you know. So those were up, but some of the old ones were there, and they did rust. I just gotta. They'll never get wrecked. I'll just scrape the rust off.
I've been to gyms where there's like an inch of rust on everything, so you're fine. So before we get into the main topic, which I've been waiting for a couple weeks, we did unfortunately have another untimely death in the bodybuilding world. This woman had competed in Tampa, so I saw her compete. Her class was women's physique, and there were over 40 women in the division, so I honestly didn't notice her, unfortunately. It was her pro debut. She just turned pro. Her name was Mariola Sabinovic Suarez. She was 43 years old, and 2 days later, this is all the info we have, is she had a heart attack and died. I mean, heart attacks, they do happen in women, I'm sure, but it's mainly a male thing.
So here's the thing. You know, I was going to do something about this, but I just didn't want to touch it, and we're so busy, but it's very important. Here's the bottom line. It may not have been a heart attack. It's, what's to say, cardiac. It's kind of like my discussion I had about Rich Piana, where it's called cardiac arrest. And you cardiac arrest not just because of a blockage. You know, heart attack for me, and to the medical term, means a blocked artery that leads to reduction in circulatory flow, and then the heart has a problem with no blood, and it has a problem and it dies off. And when that happens, the heart has a problem getting blood flow to it, and then it doesn't pump properly, and it goes into a rhythm called VFib, VTAC and VFib, and you die. Now, you can go into a dangerous rhythm because of what she might have had, some other electrolyte abnormality. So this is the truth. So she arrested, and did she have bad genetics? You just don't see women have heart attacks, right?
I mean, everyone I've known that's had a heart attack has been a man. I'm sure women...
Younger. And women have more durable hearts than men. They live longer after suffering a heart attack. They're more durable with congestive heart failure. This is all stuff I teach, so no one argues that. So why? I don't know. Men's hearts are bigger. This has nothing to do with steroids. This is why I love to provide and integrate real medical data into the steroid world and tease out wherever it falls, and that's why we need studies. So she died. So sad. She had a 7-year-old daughter and a husband, a nice-looking man. It's just so sad. Someone's out of a mother and a wife and friends, and it's so sad. Why did she do it? Why happened? Did she have known coronary disease? Does she have really bad genetics where her family members have early heart disease, and then with or without steroids and the drugs she used, she had a thrombus, a clot in there that just lodged, and she's dead? Or, this is the interesting piece of it, why I want to talk just 2 seconds on it, did the use of diuretics, clenbuterol, and but you don't see it happen, because I'm ready for the argument. It never happens. It really doesn't happen. I mean, you don't see it happening. Does it say it? Does that mean it's okay? No.
Well, but you say it never happens, but I mean, I've always known diuretics. They throw your electrolyte balance completely out of whack.
But people don't die, Ron, all these shows. And who's dying?
Oh, I mean, yeah. I mean, I've seen...
I'm just saying numbers, like 40 women. Right. Not 40 women in that show, there's 40 women in every other show, and there's more people doing it, and they're using diuretics, a little bit of steroids. Look, they're using, as you know better than me, Anavar, they're using oral Winstrol, little equipoise, they're using Clen, some diuretics, thyroid preparations. Now you put that all in the mixer, and then it's called refeeding. So I want to say this, refeeding syndrome. When we've taken, as medical physicians, as internists, we've taken care of, I certainly have a lot of anorexic people in the hospital. Obviously, for me, they've all been women. And this is not big orexia. This is not that.
Anorexia.
This is real anorexia nervosa. When you see that, the risk for us, they're on watch for I'm just looking at my medical student. Potassium. They're going to die. They're going to be hypokalemic, and they can go into asystole. It's a dangerous rhythm, which means the heart just doesn't pump. That's an arrhythmia, right? Medical student over there, he doesn't know this stuff. He knows it. When he does residency and he's got to walk around with a pager and be on the code team, he'll know what that is then.
They still have pagers?
I don't know if they have pagers. They do have pagers, he said.
Okay.
I'm not that old yet. I'm getting old. So she might have died from a straight up old fashioned blockage in the coronary artery, which is a heart attack, or she might have died kind of like more in the lines of how Rich is. When I did Rich's, please look at Rich Piana's autopsy. When he didn't die from an obvious heart attack, and then the autopsy said unknown. It could have been an electrolyte abnormality, including insulin use. It could have been just some activity, electrical activity, where he arrested, and that means the heart's just not pumping. But it's not from a blockage. That's all I want to say.
Okay.
So, and what I want to say with that, Ron, is it's so complicated. Medicine, look how complicated. Everyone loves to jump in because we want to have answers, simple answers. We don't want to have complicated answers. The truth is, these are complicated, unknown answers. We don't know. So steroid use, diuretic use, but it is rare. It doesn't mean it's right. I see a lot of guys coming in still suffering, but they're still going to move. They're still going to be walking around, but kidney function's down, heart function's down, and I have to help them preserve what's left.
Well, that transitions right into our topic for this week. You did a video. Of course, this is one I had to talk about because it's near and dear to my heart. When bodybuilders retire, I think pro bodybuilders, top amateurs, they're in a unique position when they retire. Let's just say pros from other professional sports, because bodybuilding is all about your appearance. It's not about how you played football or how many. So Joe Namath hasn't played football in 40 years, 50 years, I don't know. And no one's expecting Joe Namath to go out on the field right now and in the Super Bowl and play with the young guys. I'm going to use an example from Boston Celtics, because I'm in Boston. Larry Bird, he's 62 years old now. He retired 27 years ago in 1992. Nobody would expect him to jump out on the court and still be able to do today what he did in the 1980s when the Celtics were winning the NBA championships every year. But bodybuilding fans, they're a lot more demanding and a lot more unrealistic in their expectations. They expect these guys, to look the same as they did in their prime, even if they've been retired 10, 20, 30, 40 years. I remember I did I did a couple interviews with Franco Colombo. Franco's like 85 years old, okay? I think he's like 87 or 88 years old. And people were like, they were actually knocking his build and saying he lost his gains. And I was like, you idiot, are you kidding me?
Wow.
So there's so much pressure on these guys, externally anyway, and I'm sure they put it on themselves too, to maintain a certain look. So a lot of bodybuilders retire from competition, but they feel the need to maintain that physique and that look until the day they die.
Look at Kevin Lavorne. I mean, and these amazing men. I'm amazed at him. He's an incredible guy.
Yeah. He's
my age, and even Ronnie. I mean, come on, it's so hard. It must be so hard for them psychologically.
See, I mean, some of them can. I guess it's how much you put your identity into that. I was never a pro, obviously. Maybe I'll be a pro someday. Who knows? But I can't imagine not being a lot bigger than the average guy who lifts weights. I can't imagine just losing all that. Having that superhuman size and getting all that attention and looking a certain way, that your identity unfortunately gets wrapped up in looking that way, and the way that people treat you and the way that they look at you, and just the type of attention you get as this big bodybuilder, and then to lose all that, what would that mean?
That's why I brought that up. The depression that's in there, right? It's got to be some depression.
I imagine some of these guys, the ones that can keep doing it indefinitely until something, you can't keep pushing a couple grams of steroids a week and all this stuff forever. Eventually, what's going to happen to you, doctor, from a medical point of view? Eventually,
you're not. I mean, there's no way it's sustainable. I mean, no one's going to ever say that. None of them ever do. Something stops them, like a freight train, a heart attack, kidney failure, and some of them and that's why the video is so amazing, that you look at some of them. And who is the one guy that's the most dramatic? What's the African American guy who what's his name for the night? I'm just blanking on his name. He's so small, he's off the radar. Remember how big he was? He was just incredible. And then not Sergio. He's in the video. I have so much going on that I make these videos, I move on, and I don't remember, some of them are the names, I guess. I should.
I don't remember who was in the video.
Medical things I remember. Yeah. So, but they shrink and they look cachectic. I talked about what happens in that post scenario about the endothelial dysfunction. It's true. I mean, I discovered some incredible things with other doctors, and they basically have accelerated muscle disease, and they look teeny and tiny. I don't want to say names, but there are some other people that they look like they look anorexic and like they have AIDS and cancer.
Yeah, I mean, I don't know how many of those you did say in the video that's not everybody. You don't know why that happens, and that's not a universal thing, because we've talked before. And remember how scared I got when you said, some of these guys, they're going to lose muscle at an accelerate. The sarcopenia for them as they age, because they were steroid users and they carried this extreme amount of muscle. Some of these guys will lose a lot more muscle than the average bear.
But they do, though. They look at them, though. They look horrible, and it's not just horrible. I don't want to say horrible, but that they don't even look like just some muscular guy that's in his 50s or 60s. They're wasted. They're cachectic. Most of that is because they're off the amount of steroids. Most of it, though, I take care of them. Most of it is because they have organ disease, heart and kidney disease, and they're cachectic and they're catabolic.
You use that word a lot, cachectic. What is that?
That's when you look at a cancer, that's wasting. That's cancer, cachexia.
Okay. Cancer
or AIDS, when someone is sick and they've lost tons of weight. Cancer.
It's a medical term for wasting due to like cancer, HIV,
correct.
Something like that.
Correct.
Okay.
It's a medical term for a disease-related severe weight loss.
Because Tuliados mentioned that the other day. I said, I got to find out what this word means. Even
muscle waste. It's muscle.
Wasting. Okay.
Your body is catabolic versus anabolic, right. And it's because of accelerated disease process with inflammation and cancer and AIDS and they have. So I've worked with neuromuscular specialists. Some guys have come in that are not pros, but they had this stuff accelerated on steroids, and I mentioned there's a anabolic steroid-induced sarcopenia. That's, wait a minute, anabolic steroids grow muscle. I know. I don't want to talk about. I don't want to scare you. It's rare, but the muscle tissue actually becomes damaged from anabolic steroids. Now, very rare. I've seen a handful of cases because these are neuromuscular experts that I send them to. UCLA, University of Washington, I remember what years back, and they biopsy the muscle, vastus lateralis, and they look at it under a microscope and they say, this muscle is damaged. There's some damage to it.
Wow.
And that could just be a chemical, that could just be genetic, that person had a propensity for that neuromuscular sarcopenic, that damage of the muscle, and the steroids just set it up that it grew, and then it set up a disfiguring, and it just we don't even know.
Yeah, I mean, it's we don't, if you don't know, I don't know, but we're talking about in that situation, the steroids made the muscles grow to this extreme size So conversely, when they come off the steroids, eventually later in life, either by
And
choice or by they're forced to, they lose muscle at a much worse rate than they would have.
Listen, it's true because I've seen it. Because why? They've teed up, they've hypertrophied, and in some cases hyperplasiaed, which is the satellite cells, growth hormone, and insulin. No one's going to argue this. This is very high-end exercise physiology stuff. I'm not an expert in that. Yeah. I'm an internist. I'm a testosteronologist. Right. So you've set that up for years and years and years. They hit a peak. The muscle structure, the molecular, the cellular muscle, actin, myosin, the fibers are damaged. The whole unit is damaged. And why? Is it oxidation? Is it the anabolic steroids grow so much muscle and it recruits satellite cells for hyperplasia, hypertrophy, and then hyperplasia, where you're getting that's with the growth and the extreme training, calories, insulin, growth hormone, steroids. You're not just growing in your hyperplasiaing your cells that you were given by God, these incredible genetics, the muscle bellies, but you're actually recruiting and developing quiet adjacent nuclei. This is true, but this is just everyone knows.
So hyperplasia, you're actually developing new muscle cells, right?
You're waking up, you're growing new muscle cells that were quiescent or not existent at all.
Okay.
Nuclei, cells that were there.
So in that circumstance, I don't understand why, if someone's been able to multiply their own number of muscle cells, I mean, on the surface, it seems to me like, why wouldn't they have more muscle mass when they retire?
So you're stimulating it. There's something called downregulation. There's so much overstimulation. The way it grows is larger and functional when it's young and healthy at a certain point, but then as they get older, then there's kidney disease, there's endothelial heart disease to greater or lesser extents, and then at a certain point with the telomeres on you're oxidizing and aging. That's why when you look older, you don't gain muscle, you end up, everyone's gets shrinking. So when you put it all together with an individual, you can get this exaggerated pathologic type of muscle destruction. Yeah. That's it. That's nothing more to say. It's a mouthful. Boy, what a good show. I'm not a neurologist. I don't know about this.
Well, but, I mean, I don't even know how much neurologists know about this particular phenomenon, because why would they need to?
They don't. They don't. So they don't. And then so I sent these guys over years to some of these doctors. What was what do we do? Because the guy went from benching 315 for like 8 or 6 or 10, and then he came to bench 2 1/4. It's like he has some neuromuscular disorder. I've seen that on young men, and then that's why some guys say, I want to see a lot of comments. Then coming off steroids, you reset the receptors. This could be a good show, right? Reset the receptors, and then how do you reset? So that's why steroid users shake it up, come off, reset the receptors. They use cleaning agents. Antihistamines. Have you heard this?
You talked about it. I never heard about it before you mentioned
it. My patients have told me this
Benadryl.
Stuff. But I'm not kidding. Don't be careful. So it's like, but there's some growth phenomenon that when you get to a certain point, and then you reduce the amount of anabolics. There's an overshoot, and then again, everything's multifactorial. Their kidneys are not fully functional. They have chronic kidney disease. They're still walking around. Maybe they're going to dialysis in a couple of years. Maybe I have them. Wow. I got these guys today. And then none of these hearts are normal, Ron. I'm just telling you that there's none of these hearts are normal after 30 years of being, 270. And it's not going to be there. There's diastolic dysfunction. There's low ejection. I talked to a guy today. He's got a low ejection fraction.
I think it should be said, because a lot of people see these before and after pictures, and they instantly assume that all these guys they wanted to maintain their size. We talked at the beginning. There are a lot of guys who either psychologically they can't deal with being smaller, so they still try to maintain that mass, or they feel pressure to keep looking that way forever. But there are others who, Dorian Yates is a good example, because Dorian is much smaller now than he used to be. He used to be 300 pounds in the off season. Now he's I don't know. He's probably about 220 pounds. But he decided at a certain point, once he retired, he stopped taking heavy doses. He just went to TRT. He was still a big guy, but eventually he had he had shoulder problems. He had torn his bicep and his tricep. Eventually he stopped fighting it and stopped trying to stay large, and now he does things like yoga, bicycling, Pilates.
I see it.
Mostly veg. I don't think he eats a lot of meat. So a lot of these guys, when we see them, we automatically assume that they didn't want to shrink down that much. Some of them actually did.
Well, because they want to feel better too.
Right. I mean, I don't think anybody feels great at 300 pounds.
Especially when you're 55 years old.
That's what I'm saying. When you're 60, I don't see any 300-pound ripped 60-year-olds.
Yeah.
They're either dead, they died before they hit that point, or
when older, what's interesting? I've seen a few of these, and not in America, but more outside the country. When men start bodybuilding and using steroids in their mid or late 40s or even later, then you see incredible stuff because they've been quiet, so they never had any of this, and then they're doing it. So when you do see men that are older, that are huge and jacked up and clearly on steroids, it's interesting that how long you've been doing it. I started at 45. And so remember, so the clock is ticking now for them. They didn't do it at 25 or 30 or 18.
Well, it's you bring up a point with I don't know if you remember the late Don Youngblood. He was he won the Masters Mr. Olympia one year. He beat Vince Taylor somehow, but he didn't start competing. He didn't start. He was like a trucker. He owned truck. He had a big trucking company that he owned, and I don't think he started with all the training and the drugs till he was about 40.
There you go.
And unfortunately, he didn't live. Once he turned pro, he didn't live much longer. He was a big guy. I mean, I was around him a few times. Big, didn't look healthy. Not that that's always the best way to judge appearance, but every time I was around him, especially in the off season, I was thinking, this guy doesn't look good. Like his skin was like beet red, and massive heart attack. He did pass away, I believe. I want to say early 50s. So I don't know. It is probably safer, obviously, because they haven't been doing gear for 30 years. A lot of these guys who are 40, 50 started when they were late teens, early 20s with the gear.
That's it.
Now we're getting way off topic. So I want to go back to when bodybuilders retire, or when they give the reasons you talked about for retirement. Sometimes they're forced to retire because of injuries. Illness obviously happens to a lot of people. Others, the career is just going downhill. They're placing worse. The guy that used to be winning contests and now he's getting like third call out. The writing's on the wall. It's time to go. But you're saying anybody who's abused, so I don't want to say used because this is the way we bodybuilders use these drugs. It's abuse. It's not use. Anybody who's abused steroids for, let's say 20 years. Let's just make that the standard number we're using. What kind of organ damage are they all basically going to be looking at to one degree or another?
It's the basic stuff. It's that endothelial disease that I talked about. The endothelial, their inner wrapping, got it right here. The inner wrapping of the artery, and then I got new models actually, the heart. So they're going to have some degree of coronary disease, and the meat of the left ventricle is enlarged and dysfunctional, and then throughout the whole body, but more importantly, directly for the kidney, I see it every day. They have what's called chronic kidney impairment, if not completely worse, and that's because for 20 years of steroids, with or without hypertension, too much protein, non-steroidal anti-inflammatory drugs, they're going to end up, damaging that very fragile lining. And your heart and your kidneys are the most important. No one's going to forget the brain for a minute. Yeah. The heart and the kidneys are so sensitive babies. They break anyway. If you live long enough, they break. When you do steroids and you're hypertensive and you affect your lipid panel and you put dangerous forces, forget training hard, that are constantly, because you're using estrogenic steroids and your blood pressure is elevated, because you're puffy and you're estrogenic with or without aromatase inhibitors. This is what I'm seeing. And you're hypertensive. Your HDL is always going to be lower. And if you're a man that has risks naturally because you have bad family history and low HDL from naturally, that's another risk. So when you put all those together, the heart and the kidney are going to get, so I talked to a man today, he's on steroids for 20 something years. He is 40 something. His chief complaint to me, exhausted. Sure enough, he has left ventricular hypertrophy, he has diastolic dysfunction and chronic kidney disease.
Wow.
Done. But he's a 40-some-year-old guy.
How do you treat that so he has a better quality of life, though?
So he's got to stay on. So he's been going on and off TRT. When he goes off his TRT doses because he feels guilty and his doctors don't understand. And he's not a doctor. He doesn't feel. He's just a decent guy with a family. He doesn't know what to do. Talk about depression. So he goes off and then he tanks and he feels even worse. But then when he goes on, he's estrogenic. He's filled up with fluid. His blood pressure is worse. You see, this is what I have to deal with. So, because his kidneys are not fully functional. I mean, his creatinine clearance is very low, probably 30. Wow. His creatinine is about 2 point. I see this all the time, 1.8 to 2. So he has moderate chronic kidney disease forever.
Wow.
And no one ever, and told me, no one even, because he wasn't going to I don't know who was looking at it, but who even cares? No one diagnosed it. So he has a little bit of heart failure and a little bit of a little bit more than a little bit of kidney failure. He's not going to dialysis anytime soon, but he probably will be in dialysis sooner or later, and we'll have to get a transplant for him.
Wow. He
feels exhausted. He goes, talk, sex? So I asked him about, the third thing on the list. Well, how's your libido? My libido? I try to get out of work I try to get out of bed to go to work. I'm exhausted, Doc. I just can't breathe. So he had a cardiac workup, and he doesn't have any heart blockages. He has some plaque in there. Calcium score was like 35 or something. So it's like that's not that bad. But his heart is enlarged and dysfunctional. It's from putting it on steroids for 20 years. I'm not bullshit. I mean, yeah. I wish I was making it up. I wish
I wish you had some better news. That's what I'm wishing for.
But I mean, the truth is, don't do steroids. If you do steroids, don't do too much. Scour if your heart starts to look bad and your kidneys start to look bad, get off the train.
Yeah.
And just live on TRT. What am I going to say? What possibly more?
I know. I mean, that's.
What can I say?
I'm always looking for you to say things that you can't say.
Well, I have protective. I'm going to tell you the medicines: ACE inhibitors, PCSK9 drugs, statins, but use them carefully. Diuretics, I mean, I'm showing all the secrets. I mean, I'm not. There's no secrets.
I mean, you're doing that like it's like the title of that the movie about global warming, An Inconvenient Truth.
I believe it's true.
This is an inconvenient truth.
Schwarzenegger has no secrets. I know his doctors. There's no secrets going on. Yeah. There's no They don't have because he's worth $500 million. What is he worth? $500 million or something? Maybe, I don't know. I mean, who cares?
A lot.
I have the richest man. I have the richest man in the world now. They don't.
Is that Bill Gates?
I got some of them, man. I got some of the richest guys in the world now.
Jeff Bezos. Okay.
Not that guy.
Lip shield. Okay.
But I want. He's on. He said he's on TRT. I mean, who even cares? None of these guys, because if you're taking telomerase activators and growth hormone from the 1990s, you're an idiot. You're an idiot. You should be on old-fashioned diabetes meds, statins, PCSK9. You should be on the stuff that your cardiology guys down there in Boston. This is what I'm on. This is like these guys are. There's no secret drugs that the rich are taking. This is just it. We're not there yet. But I guess maybe in 5 or 10 years, because we have biologic drugs coming on board, and we have some some genetic stuff where they're delivering, the real mutation basis, on the DNA level.
Oh boy!
There's the most expensive drug in the world is out now for some rare disease of a newborn that has some neurogenic, horrible congenital abnormality. And it's delivered through a viral vector that goes in to change the DNA. How much does it cost? And the insurance companies are paying for it.
I'm gonna guess this is for one dose.
One dose.
Okay, hang on. $2 million.
About $1 million and change.
Wow.
And Aetna and Anthem and Cigna they're working out a deal.
Wow.
Because you know why? Tell me why. And not because they have to, because they don't have to do anything.
They don't have to. I mean, the government must be like paying them back or something. I don't know.
No, the government. This would be great if the government was paying them back. The truth of the matter is, because taking care of that poor suffering child over the course of the first 3 years will cost a hell of a lot more than $1.2 million.
Oh boy. Well, I mean, we're getting way off topic, but is this kid going to be with this drug? Is this child going to be live a normal life?
I don't even know. This is a very rare disease. But if you research this, everyone's going to research it. You'll see I'm right.
No, I believe you. That's insane. That's just insane.
So it's a viral vector, and it's out there. So here we are. The race is on, and unfortunately, it's not going to be. The rich sooner or later will have myostatin changes and real anti-aging medicines. It really will happen, and it's going to be seen in our lifetime. Wow. And problem is, it's not going to be affordable and accessible to the common person with great insurance.
Well, I mean, I can't see aging in reverse, something like that, if that becomes available somehow. Why would that be something that every human being?
But Soylent Green
is entitled to. Soylent Green is people, but
yeah. So Soylent Green, I knew you love that. You're the literary guy.
I was gonna make a T-virus reference from Resident Evil when you're talking about the drug that's a virus going into these people. But I don't know if.
But so guys, it's sad. What you just brought to my attention is amazing. I never thought of the actual day-to-day. I said they're walking around, they don't feel good, they used to live a certain way. But I also referenced more that they feel. That's why Dorian, I assume, is done when he's done. He just feels better, lighter. You're going to feel your blood pressure is going to be better. Your energy levels are going to be better, and your kidney function and your heart function. It's all about that. And if you live long enough, your kidney and heart function takes a hit anyway.
Yeah.
So this lifestyle accelerates aging, Ron. I'm sorry.
No, I know. It's just like I said. I hate to hear it. I know it's true. When they look at people who live long lives, they typically are lighter people that didn't eat. They didn't have a very high caloric intake. So those of us who sit here pounding down 5,000-6,000 calories every day, eating every 2 hours, putting down 300 grams of protein every day, on top of the steroids. I know it's a recipe for disaster. It's just, it's hard. It's a bitter pill to swallow for us.
From 2 years ago, Ron, or whenever we started the show, you're coming a long way. You've really come a long way, Ron. You really have.
Well, I'm learning. I got a doctor. I get to talk to 2 doctors every week now. Yeah, one. We got you. I got the Dr. Tulianos, but he's awesome. Are you going to the Olympia, doctor?
I don't know. Should I go?
Dr. George wants you to go very, very badly.
That's right.
He wants to do a dinner. He wants us to do like a roundtable interview there. So just throwing that out there. He'd be very pleased if you made it there. The other thing I know is you did mention the chronic trauma and nerve damage, because the organs are one thing. Obviously, that's a major concern because that's life or death. But we also see the way that I'm sure powerlifters go through this too, because they're subjecting their bodies day after day to these ungodly amounts of weight bearing down on their spine, their joints, their connective tissues. So you do that for, say, 30, 40 years before you stop, before you can't anymore, because you would know better than I, but I don't think there are any 70, 80-year-old guys like benching 1,000 pounds or squatting 1,000 pounds, right?
No, not yet.
I mean, well, let's hope not. That's probably another inevitability that a lot of bodybuilders, even those who never got that far competitively, anybody who trains heavy for that long they're gonna suffer consequences.
Look at Ronnie. Ronnie is back.
That's the most extreme. That's 10 or 11 spinal surgeries. Both hips replaced, although he says the hips were a genetic thing. Man, I mean, this is kind of depressing show this week, but
I'm so sorry.
It's okay, but it's reality, because I wanted to do it because I want hopefully some of the younger guys out there who like to troll, and that's a verb now. Troll is used as a verb. If they see any bodybuilder that's lost some size, man, they go hard on these guys. They roast them. They're like, LOL, he lost all his gains. LOL, I guess he was all drugs. And, you know, they don't care. You know, say if you're living your life to please the trolls, you'd stay 270 ripped all the time.
Oh my God.
And then, you know, when you have a heart attack and die, or your kidneys fail on you, are they going to pay your medical bills? Are they going to take care of your family?
Who cares?
You know, I get so mad sometimes. I don't know why I let myself get so worked up about it. I did want to bring up one example, because you remember Larry Scott was the first Mr. Olympia, 65, 60. So he won it twice, and then he retired at like 24, 25 years old, because there was no money at all, none. There was no money in bodybuilding back then. And I remember that he wanted to see who he was without all the muscle. So he stopped training. He stopped whatever tiny amount of gear that they were using back then, and he went from, I don't know, like he was never, the guys back then weren't obviously the size that we see now, but he went from something like 210 or 220 down to 130 or 140. And I remember reading an account where Arnold saw him at this lighter weight, and he showed up to sell, because he was like selling life insurance or financial planning, something. And Arnold was just like flabbergasted how small, how tiny he was. But, you know, Larry eventually got his muscle back, but he wanted to intentionally see, who am I without all that muscle? How will people treat me just as a man without having that? They see me and they're not going to see all that muscle, so they have no preconceptions about me. I'm going to have to prove myself as a man, as a human being, and what's that going to be like? And he did it. So that took guts, man.
I never knew that, because he looked, in the end of his life, in his 40s and 50s, he looked awesome.
He did. He looked better I think he looked better in his 40s and 50s.
The arm, he had that great arm, man.
Yeah, man, he had those biceps of his were crazy.
But he looked great in his 40s and 50s.
He did. In fact, I think he did a photo shoot for Iron Man when he was like 50. The Mike Neville shots, you can still find him if you Google him online, and man, he looked amazing at 50, 54, whatever he was.
He lived till his 80s. He lived a very good quality life, didn't he?
He lived a nice life, yeah. Cause
he lived on probably TRT for the last 30, 40 years, maybe, or probably, who knows?
If that, who knows if he was even doing that? Probably. I mean, he was probably, if he was smart, which I think he was a pretty smart guy. Yeah. So I don't know how to wrap this up on a high note. I just want anyone who watches this, who expects pro bodybuilders to look that way forever, to understand that it's not healthy for these guys. It's not practical for these guys. So really, I asked them to think twice before they make any snide remarks or mock them in any way, because, you know, these are all human beings. You know, you think these are just these superstars with the pictures in the magazines, but they're all, you know, we're all born, we're all going to die, we're all just people, and please understand that I hate seeing the guys that die young, because they die like when they're 45, 50. They've been retired for 10 or 15 years, but they die because they're still using all the drugs that they were using when they were competing, and they're still looking the same or very close to it, and there's no reason for that except psychologically.
That's the big orexia, Ron. That's the big orexia that, you know, and there's no secret. I mean, there's a big film, Generation Iron, coming out next year, and we put it out there. We filmed a couple of times. I got patience on this one. This is going to be a big one, man.
Patience or Haitians?
Patience.
Oh, okay.
Patience of mine, yeah. No, I got Haitian patience. Patience from Haiti.
Yeah, well.
So no, but this is going to be big. They put a lot into this, and I hope it comes out. I mean, we've certainly filmed a lot.
It'll come out. I mean, they have their system down as far as putting these documentaries together and releasing them. They're
so big.
Iron's awesome at that.
This is going to be big orexia, and this is going to be. I have 3 patients. One patient is unblinded, where they didn't dub him out, they didn't change the voice or anything.
Wow.
The other 2 guys are, you won't know who, the witness protection program stuff.
It's too bad that Generation Iron and MD are rivals, because Vlad could have called on me. I would have been an amazing interview for your movie, Vlad. Oh well, dude.
But though I'm so, you know me, I'm like a priest in the streets. I'll go anywhere. Anywhere
you're needed.
I'll go in. I'm kind of like some guy goes, Doc, you're like a Gandhi. You're kind of like a Gandhi on steroids. He said.
Yeah, Gandhi. Gandhi looked. I'm going to use that word now all the time. Cachectic. Gandhi looked cachectic. But it's my new word.
Gandhi holding off the cachexia on steroids. I mean, that's okay.
Yeah. No, I applaud you for getting your message out. Major newspapers, magazines, anyone that needs to get this message, and I'm glad they come to you because there's very few people in the medical profession that they could get this perspective from. You probably know every single one of them in the USA that has a similar level of knowledge to you.
There's a few. Yeah, so I'm doing the big research survey. We're announcing my big research any day now.
Okay. Where can people find? Are you going to make a video announcement on
my YouTube? Yeah,
Anabolic Doc. Okay.
Yeah.
Okay.
We're just waiting for the IRB. We're trying. The lawyers are signing off.
Wow, this is going to be exciting.
Oh, this is the biggest thing in the world, folks. Biggest steroid research project in the world.
Wow.
Coming up.
Dude, if there's free steroids involved, you'll have no shortage of volunteers.
There'll be no. It won't be. It will be a survey, and you have to go online and take our survey, please, Ron.
Okay, that's fine.
You'll see. You'll be doing it. It'll be. It's not. It's going to be no information held. We just want to know. It's a man, and you're 18, and then you agree, and then you move through all the questions. But we've been writing this up for total time, a couple years. We've been these questions, and I did a whole announcement with the other doctor. My suit is on, and we have IRB support, and this is a big, major research institution that's supporting me finally.
Wow. Congratulations. Well, I'll congratulate you after you make the big announcement.
Yeah, we don't even. The IRB may shut it down. It may not happen ever.
I'm just saying.
We'll see. I'll move on to the next.
Okay. Well, that is all we've got for today, Doc. We meandered all over the place as usual. But when Bodybuilders retired, that was the main focus, everybody. If you go back, we did touch on that many, many times. We kept coming back to it. So I want to reiterate one more time, everybody. America on Steroids is the book. Pick it up at your local. Well, I guess you got to get it online at metabolicdoc.com or amazon.com. Also, check out the YouTube channel, Anabolic Doc. He's dropping videos every week. I only steal the best of them or the ones I'm especially interested in, which is why I stole this one today. And that is it. Thank you so much, Doctor, for your time, your expertise, doing good work, and we're trying to get the message out to as many people out there as possible. Testosterone.
So much.
All right, everybody. Thanks for watching. Ask the Anabolic Doc. We'll see you next time.